Thanks for staying with us and welcome back. You're still watching Newsnight. We're live from Nigeria's capital in Abuja. The Nigeria Center for Disease Control and Prevention, NCDC, has issued a public health advisory urging Nigerians to stay vigilant against Chikungunya, a mosquito-borne viral disease amid rising global cases and fatalities. The warning comes as the ongoing rainy season and flooding heighten the risk of mosquito breeding and potential outbreaks in the country. According to the World Health Organization and the European Center for Disease Prevention and Control, more than 240,000 Chikungunya cases and 90 deaths have been recorded in at least 16 countries in 2025. China alone has reported nearly 5,000 cases since early July. While rarely fatal, the joint pain can persist for months, affecting the quality of life. NCDC Director General Dr. Jide Idris says no confirmed cases have been reported in Nigeria in 2025, but stresses that the nation's environmental conditions, particularly in flood-affected areas, could facilitate an outbreak if proactive measures are not taken. All right, we'll have a guest. Tochi Okwor is the Acting Director, Disease Prevention and Health Promotion of the Nigerian Center for Disease Control. She joins us in the studio to shed more light. Chikungunya. I hope I got that right. Yeah, it's a new strain of mosquitoes, and we know mosquito is being malaria, derived from mosquito bites and the rest, is #1 killer disease in the world, and now you're having a new strain, and the Nigerian environment is still not really, clean to prevent such outbreak here. What are the potential, problems we're going to have with this?
Well, to first of all put it in proper perspective, chikungunya is the name of the disease and the virus that causes it. It is not a mosquito, but it is indeed one of those diseases that mosquitoes transmit. That is why, even though Nigeria hasn't recorded any case of chikungunya disease, we at the Nigeria Center for Disease Control are laying a lot of emphasis on prevention. So as we watch the numbers globally, we want to begin to inform Nigerians that there are indeed things they can do to protect themselves and also to protect the country in general.
Okay, this warning coming from NCDC, are you collaborating, for example, with the Ministry of Environment and other relevant stakeholders about, the cleanliness of the environment and the rest, knowing that it's a strain from the mosquito that it can pass on to humans?
Yes, for the most of the work we do at the Nigeria Center for Disease Control, we actually work in a very collaborative way. We work with our colleagues in the Ministry of Environment, and then specifically in the issue of mosquito-borne diseases such as this chikungunya we are talking about. We also work in collaboration with the National Arbovirus and Vector Research Institute, whose job also is to monitor the mosquito population in the country. We are very careful to give to Nigerians the information they need to take care of the environment. The Ministry of Environment are part of our working groups. We have different working groups targeting different disease conditions in the country. And speaking about those ones that are prevented by taking care of environment, the Ministry of Environment is a very important stakeholder.
When is the mosquito population higher in Nigeria? Is it during the dry seasons or the wet season?
The place that these mosquitoes love, they love to breed in stagnant pools of water. So you see, during the rainy season, when we have a lot of flooding also, then it means that there'll be pockets of water collected in different receptacles. And we actually have issued an advisory around the middle of July, I think around the 16th of July, following the risk of flooding. We had preempted it and informed Nigerians that please, flooding comes with certain risk factors. And one of them is also risk of exposure to diseases that are transmitted through the bites of infected mosquitoes. And we have then communicated to Nigerians that please take care of your environment. Avoid water collecting in receptacles, discarded tires, things as simple as discarded pure water plastic sachets. As long as it can accumulate a little bit of water, mosquitoes will find their way to thrive there, lay their larvae there, and then the mosquitoes will hatch.
Can that be said, can the same be said of situations in the arid regions, you know, the far north and the rest? In Kano, mosquitoes, I mean, cause hailover of problems there for the people.
Well, it's a bit nuanced, because even when you don't have rainwater so much, if people are water poor, if people need to collect water in receptacles and store in their homes because they also do not have access to flowing and running water, it can also create opportunities for pools of water to collect in receptacles.
Okay, that's great. I mean, with the flood warning and the rest, because, I mean, it creates fertile breeding grounds for these mosquitoes and the rest. And your advocacy to keeping a clean environment, is it extended, you know, to working in collaboration with the Nigerian Emergency Management Agency because of, you know, the flood warning that has been given and that people should leave lowlands to highlands and the rest? What kind of collaborative efforts does NCDC as a stakeholder here have with NEMA? Any?
We do have, but you realize that every situation is a matter of scale and size that will determine the sort of incident management system that will be put in place. But we all use the climate data to function. There are channels of communication between the ministries and departments and agencies of government. And whatever level of response that needs to be activated is usually activated depending on what's going on.
If I may ask again, I mean, to further that, what level of response, you know, is the NCDC put in place, for example, with the flood disaster warning? All federal government and the other governments at the state and local governments evacuate to where, for example?
So for us at the NCDC, the mechanisms we have put in place are a couple of them. We also focus on prevention, so we are using a lot of risk communication approaches to empower communities to take community action. We know the diseases that are prone to these circumstances, and therefore we increase our surveillance. We prepare our laboratories. We continue to make sure that if any cases are rising, our laboratories are primed to pick this up. We are just not doing this at the national. We work in collaboration with the states and the other levels of the subnational. Because indeed, the places where these things happen are not at the national. These things happen at the state. So we work very closely with the state structures. We continue to encourage states also to make the right type and levels of investment to handle these things. And when people then get sick because of these things that happen, we are also work with them to improve their capacity for case management. Because some of these conditions that we are watching need special kind of case managers, be it physicians, be it nurses, and even people who work in hospitals to prevent infection. Yeah. So for us at the NCDC, we look at it through a very holistic lens and continue to empower levels at the subnational, continue to collaborate at the national to provide as much resources within our mandate.
Okay, Dr. Tochi, before we let you go, tell us the kind of case management, you know, dexterity that the NCDC is brought to eternally displaced persons camps in the country, because we hear often outbreak of one form of disease or the other and the rest.
So internally displaced camps, let's take a very practical view. What are the challenges and the risks that could arise in internally displaced camps. One would imagine that there will be challenge with respect to hygiene, and so diseases such as cholera would be predominant. If care is not taken and management of vectors and rodents, then Lassa fever could be a problem. So at the Nigeria Center for Disease Control, we maintain a database of case management, but more importantly, we do train on Lassa fever case management. In that kind of setup again, when the conditions are right, cerebrospinal meningitis could also be a problem. And at the Nigeria Center for Disease Control, we support the responses at that level to continue to improve the dexterity and the ability of the clinicians who work at that level to be able to take care of cerebrospinal meningitis cases, particularly on things like lumbar puncture and what have you. So every disease has its own special capacities that case managers should have. And at the Nigeria Center for Disease Control, we work in collaboration with other ministries and agencies to train and indeed maintain even a database of these case managers.
Thank you so very much for shedding so much light on the Chikungunya mosquito, strain that is hit 16 countries so far, and the NCDC is saying that it won't occur here, or you try to prevent it. Dr. Tochi Okwor, Head of Disease Prevention and Health Promotion at the Nigerian Center for Disease Control. Thank you very much.
Thank you.